Have you ever felt unusually thirsty, tired, or noticed your vision getting blurry? Many of us brush off these symptoms thinking they're just part of a busy life. But what if they're actually warning signs your body is sending you signals that your blood sugar is out of control? Diabetes affects more than 37 million Americans, and nearly 1 in 4 people don't even realize they have it. Left untreated, diabetes can lead to heart disease, blindness, kidney failure, and nerve damage. In today's video, we'll break down 15 of the most common and sometimes surprising symptoms of diabetes. We'll also explain why these symptoms happen, how to spot them early, and when to seek help. Grab a notebook if you'd like to take notes, because this information can literally save lives. Why do diabetes symptoms occur? Before we dive into the list, let's quickly understand what causes these symptoms. Diabetes is a problem of high blood sugar. Normally, your pancreas produces insulin, a hormone that helps move glucose out of your blood and into your cells for energy. In type 1 diabetes, the immune system destroys insulin-producing cells. In type 2 diabetes, your body becomes resistant to insulin or doesn't produce enough. As glucose builds up in your bloodstream, it starts affecting your body in many ways, from your eyes to your nerves to your kidneys. 15 common symptoms of diabetes. Let's go through them one by one. 1. Frequent urination, polyuria. One of the earliest and most common signs is needing to urinate more often, especially at night. Why does this happen? When your blood sugar is high, your kidneys work overtime to filter and remove the excess glucose. As glucose spills into your urine, it drags water along with it. This leads to dehydration and frequent trips to the bathroom. 2. Excessive thirst, polydipsia. Because you're losing more fluids in your urine, your body triggers intense thirst to replenish itself. Even if you're drinking plenty of water, you may still feel constantly thirsty. 3. Extreme hunger, polyphagia. Your body struggles to use glucose properly, so your cells become starved for energy. This triggers strong cravings for food, especially carbohydrates. 4. Unexplained weight loss. Despite eating more, many people with uncontrolled diabetes lose weight rapidly. Why? Your body starts breaking down muscle and fat for energy because it can't use glucose effectively. This is more common in type 1 diabetes, but can happen in type 2 as well. 5. Fatigue. Feeling tired all the time is one of the most frequent complaints. Reasons include dehydration, lack of usable glucose for energy, poor sleep from frequent urination. 6. Blurred vision. High blood sugar causes the lenses in your eyes to swell with fluid, leading to blurry sight. If left uncontrolled, this can progress to diabetic retinopathy and permanent vision loss. 7. Slow healing cuts and sores. Elevated glucose impairs circulation and weakens your immune system. Small cuts and wounds may take much longer to heal and are more prone to infections. 8. Frequent infections. Common examples: skin infections, urinary tract infections, yeast infections, especially in women. Yeast thrives in high-sugar environments. 9. Tingling or numbness in hands and feet. Over time, high blood sugar damages nerves, a condition called diabetic neuropathy. Symptoms include tingling, burning sensations, numbness. This often starts in the feet and progresses upward. 10. Darkened skin patches. A condition called acanthosis nigricans causes dark, velvety patches, commonly in the neck, armpits, or groin. It's especially common in people with insulin resistance. 11. Gum disease. High glucose weakens your mouth's defense against bacteria. Signs include swollen or bleeding gums, loose teeth, chronic bad breath. 12. Dry mouth and itchy skin. Fluid loss from frequent urination can leave your skin and mouth dry and irritated. 13. Irritability and mood changes. Blood sugar swings can significantly affect mood and concentration, leading to irritability, depression, difficulty focusing. 14. Erectile dysfunction. Diabetes damages nerves and blood vessels, which can impair circulation and sexual function in men. 15. Recurrent yeast infections in women. High sugar levels feed yeast growth, causing vaginal itching, discharge, discomfort. Which symptoms are urgent? While all these signs matter, some symptoms need immediate medical attention. Rapid breathing, fruity smelling breath, severe nausea and vomiting, confusion or drowsiness. These can signal diabetic ketoacidosis, DKA, a life-threatening emergency, especially in type 1 diabetes. If you experience these, call 911 or go to the ER immediately. Who's at risk for type 2 diabetes? Anyone can develop diabetes, but risk is higher if you are overweight or obese, have a sedentary lifestyle, are over age 45, have a family history, have high blood pressure or cholesterol, have had gestational diabetes. If you have any risk factors plus the symptoms we discussed, talk to your doctor right away. How is diabetes diagnosed? Your doctor may order fasting blood glucose test, a 1C test average sugar over 3 months, oral glucose tolerance test. A diagnosis is usually confirmed with 1 or more abnormal results. Can you prevent or delay diabetes? Yes. Even if you have prediabetes, lifestyle changes can make a huge difference. What works? Losing 5 to 7% of your body weight, exercising 150 minutes per week, eating a balanced diet, stopping smoking, managing stress. Final thoughts. Diabetes is serious, but it's also manageable and, in some cases, preventable. Listen to your body. If you recognize these symptoms, don't ignore them. Early diagnosis and treatment can protect you from complications down the road. Thank you for watching. If you found this video helpful, please like, subscribe, and share it with someone you care about. Remember, your health is worth every effort. Stay informed, stay proactive, and take care of yourself.